Welcome to my channel once again. Today we are going to look at heart failure. And according to Bruno and Sadat, heart failure is a clinical syndrome resulting from structural or functional cardiac disorders that impair the ability of the ventricles to fill or eject blood. So technically, in the past, heart failure is often referred to as congestive heart failure because many patients experience pulmonary or peripheral congestion with edema as its cardinal sign and symptoms. That's why previously this condition was known as congestive heart failure. Let's look at the types of heart failure. Though there are different classification of the type, which include based on severity, can be chronic or acute, and can be classified as either systolic or diastolic heart failure. But technically, today we are going to look at the sites in terms of classification because this is mostly asked during the examination. So we have the left-sided heart failure, which occurs at the left side of the heart, and then this causes blood to back up into the lungs, causing difficulty in breathing. So that's technically pulmonary edema. Then we have the right-sided heart failure, which blood backs up into the body tissues, causing swelling. So that causes peripheral edema, right? And then there's a situation where you can have both left and right-sided heart failure. Let's quickly look at some common causes of heart failure. Previously, we defined heart failure as a clinical syndrome that is actually occurs as a result of structural or functional cardiac conditions. So here are some of the conditions that can actually result in heart failure. So we have hypertension, coronary artery diseases, myocardial infarctions, and then we have valvular heart diseases, cardiomyopathy, and then congenital heart diseases, the last being severe anemia. And then the risk factors of heart failure include smoking, alcohol abuse, obesity, diabetes mellitus, old age, then high cholesterol, the last one being sedentary lifestyle. So let's look at the signs and symptoms of heart failure based on location. That's left-sided and the right-sided. And here is the key point where the examination question comes the most. You being able to differentiate between symptoms of the left-sided and the symptoms of the right-sided. So with the left-sided, we know blood will backflow into the lungs, causing pulmonary edema. So technically, signs and symptoms are going to be more of respiratory. So we have dyspnea, which is what difficulty in breathing, and then we have autopnea, that is difficulty in breathing relieved by being in a sitting position or an autopnic position. We have cough, and then crackles in lungs, fatigue due to inadequate tissue perfusion. Then let's look at the right-sided. Since blood will backflow into peripheral tissues, we are going to have leg edema here, ascites. Then we have distension of jugular vein. We have hepatomegaly. So this is cardinal for exams. So try and keep as much as possible you have. In case you come across these questions, you can be able to take them down easily. So here is just a simple diagram for you to understand the concept, that looking at the left side of this diagram, here is where left-sided heart failure occurs, and then here is where you have your right-sided heart failure. So you can actually see that failure of this ventricle to pump blood into systemic circulation, which is blood rich in oxygen, that is bright red, will cause blood to actually return back into the lungs where blood is actually oxygenated and then pumped into systemic circulation via the left ventricle. And you can now see that on the right side, failure of the right side of the heart or the right ventricle to actually push blood that is without oxygen, that is blue colored, into the lungs to be oxygenated, will now cause a backflow of blood back into systemic circulation, causing edema. So you can just picture this. The left-sided heart failure will cause backflow of blood back into the lungs because the ventricle is not able to empty as much as required blood as possible, causing pressure for blood to backflow back into the lungs. And then on the right side, failure of the right ventricle to pump adequate blood enough to empty the chamber for more to come, for blood to go back here to be oxygenated and then go into systemic circulation, will cause accumulation of blood and pressure in the right sided part of the heart and then causing it to backflow back into systemic circulation, giving you these peripheral edema issues. So over here we provide you a summary of what I've been describing in the previous image. So just take a glance of it, compare both sides, and you'll be okay. The diagnostic investigation includes the ECG, and then the ECG is just the electrocardiograph. Then echocardiography, you know the difference. They all have the ECG in them, but one is electro and one is echo. You have chest X-ray, BMP blood test, cardiac enzymes, and then you can actually go for the electrolytes. With the medical management, we can have oxygen therapy because we need a fusion of oxygen to tissue because that is not able to pump enough blood reaching oxygen towards tissues, causing fatigue. We have diuretics because of there is peripheral edema and then pulmonary edema. We need to eliminate those excess water through urine, so diuretics are given. I have a presentation on diuretics, you can check on it. Then we have ACE inhibitors. I also have a presentation on those drugs, you can check on it. They are supposed to inhibit the RAS system. That will actually cause an increase in fluid volume because there's already fluid in tissues we need to eliminate. So we need to prevent the body from reabsorbing those fluid back into systemic circulation. Beta blockers will also work on the heart as well as on the kidneys, blocking the RAS system as well. We have digoxin vasodilation aspects, then we have fluid and salt restriction, more of nursing management but cardinal as well. Summary of the few things you can do as a nurse is you have to monitor vital signs, especially blood pressure, as well as assess edema, then monitor intake and output and balance it within 24 hours. Elevate leg to reduce peripheral edema, then administer prescribed medication as ordered, and respect the rights of the patient as well. Educate patient on low salt diet, then encourage bed rest. Complications include pulmonary edema, arrhythmias, kidney failure, cardiogenic shock, and then sudden cardiac death.